Hello, I'm Dr. Robert Newton, and I'm an associate professor at the Pennington Biomedical Research Center. I've been there for 19 years, and today I want to talk to you about the Pennington Center and to talk to you about some of the opportunities to become involved in research. So my goals today are to tell you a little bit about, to provide you more information about the Pennington Center, to tell you about some of the research studies that we have, to talk to you a little bit about COVID-19 and the research that we have going on related to that infection, and then talk a little bit about the kinds of research that I do and the studies that we have going on. So let's first talk about the Pennington Center. Pennington Biomedical is located on a 2,200 square acre campus in Baton Rouge, Louisiana. It is affiliated with LSU, but it is a separate facility. It's established in 1989 by a financial gift from Doc Pennington, who wanted to establish the most impressive nutrition research center in the world. And currently our mission is to discover the triggers of chronic diseases through innovative research that improves human health across the lifespan, so from children to older adults. Currently we have about 60 researchers on campus and about 400 staff that assist the faculty members in obtaining research grants and conducting their research. So here's a quick look at the Pennington campus. And I wanted to point out just a few things for people to recognize. So here we have an imaging building where we can do MRI and to look at the brain structure and function and DEXA scans. Here's our outpatient unit where we have offices and equipment to do assessments, height, weight, blood pressure, those kinds of things. Here's another unit that includes, another building that includes 3 different units. We have the bariatric unit, which allows people to be assessed before they have stomach surgery to help them to lose weight. A children's clinic, which has equipment that is specifically designed for children. And we have a metabolic chamber where you can learn about how much energy your body is expending at a particular time. Here's our administration building. We also have a conference center that allows us and other groups to come in and to do conferences. We have a basic sciences building, and this is because we have a large number of faculty who conduct basic science in terms of research with animals and with cells and physiology, looking at chronic disease from that perspective. We also have a hotel, and then the fitness center is where we have physical activity equipment, free weights, and knowledge machines, bikes, treadmills, that allow us to do physical activity studies on campus. Now let's talk a little bit about the research studies that have been done at Pennington and some that are currently being done. So remember, the mission of Pennington is to basically to solve chronic disease. And so the conditions that we really focus on mainly are about obesity and diabetes. So we've done a number of obesity studies, looking at medications, primary care interventions, group-based interventions, and then more recently, maternal weight loss interventions. Another major focus is diabetes, and we have done lifestyle interventions, physical activity interventions, also those involving medications. And one of the landmark studies that was conducted at Pennington is called the Diabetes Prevention Program, or the DPP, which showed that if you increase your physical activity and change your diet, that you can reduce the risk of developing diabetes by about 58%. We also have children's studies that are going on because childhood obesity continues to increase in our society. We know that more than 30% of children in Louisiana are overweight. And so some of the studies we've done include extra gaming, which is using video games to increase physical activity. We've done school-based interventions involving technology, including cell phones, text messages, and then also interventions that have been done in neighborhoods to try to work with neighborhoods to provide opportunities for children to play. And then we have physical activity studies, some that use the fitness center and some where we partner with the community to provide physical activity interventions. So let's talk specifically about studies that have been done for older adults, as many of the LA retirees may be interested in these studies and may be interested in joining current studies. So one study was the LIFE study. This was a 2-year physical activity intervention, a group-based intervention. And the goal of the study was to determine if, by increasing physical activity, can you improve physical function in older adults. And this is exactly what the study showed. It was a multi-site study. It was done here at Pennington and other sites across the United States. The PACE study was a pilot study that was done in older African Americans. Traditionally, African Americans participate in research less often than do people from other ethnic groups. And so this study really showed that we can get older African Americans to participate in research, and by getting them involved in a group-based intervention, we can also increase their levels of physical activity, which can then have health benefits. The study is still ongoing, and so we're hoping to find out the effect of the physical activity on cognitive function, or how people are thinking and their memory and their attention. The RED study has recently completed, and this study looked at the effect of not only physical activity, but also blood pressure control on the effect or risk for developing dementia. So the idea is if you can improve physical activity and you can manage blood pressure in terms of cardiovascular disease risk factors, you can better reduce your risk for developing dementia, Here are some current studies that are going on for older individuals. The REAL-PUS study really tests the effect of 3 different physical activity interventions on physical function. The T2 and advanced studies both look at investigational medications for those who have Alzheimer's disease. The difference is that the advanced study is really looking at medications to address agitation and irritability that Alzheimer's disease patients often experience. Now let's talk a little bit about COVID-19. As you all are aware, COVID-19 is a pandemic, and what I'm not going to do is to talk about the typical sort of precautions that we would like for people to take in terms of social distancing and masks and hand washing and things of that nature. We're going to talk about the studies that Pennington has been involved with. So one of those studies involved testing, looking at prevalence rates, or how many people within the community actually have COVID-19. We're also going to look at the impact of COVID-19 on people's lives. And then we'll talk a little bit about a new study that's going on looking at how COVID-19 may be impacting participation in research. So a study done by Amy Freehand in a collaboration between Pennington and Ochsner looked at prevalence rates of COVID-19 in Baton Rouge. And what this study found was that about 7% of people in Baton Rouge had been infected with the SARS-CoV-2 virus. This is consistent with state, national, and international data. But there were some other interesting findings. So African Americans were at higher risk. Those who were single were at higher risk, as well as those who were going to work and those who worked in jobs where you had to face the public and where you were involved in healthcare. Another study looked at the impact of life. This was done by Amy Flanagan and other people here at Pennington. So what the study involved was sending out a survey for people to complete, and it asked them about life before and after COVID. I should say before and during COVID. So what the study found was that COVID decreased quality of sleep before and after, or before and during. They also noted that COVID had increased levels of sedentary behavior, so people were sitting more. It also showed that people were more anxious, meaning, and this anxiety was related to job security, risk for infection, and other variables. COVID also affected physical activity in that people felt like they were less active during the COVID pandemic than before. But there was also some good news in that people also reported cooking at home more, which increased fruit and vegetable intake. So there were at least one positive finding from this study. And I'm sure that many of you have also experienced some of these things as well, especially with the stay-at-home orders, that people are less active, more sedentary, a bit more anxious, and probably aren't sleeping as well. So now let's talk a little bit about my research. The kinds of research that I do is an attempt to reduce health disparities in African Americans. And then again, this is across the lifespan. So we've done one study where we looked at the effect of doing aerobic and strength training in accordance with the national guidelines in terms of 150 minutes of exercise, moderate to vigorous, that is aerobic, and 2 days of strength training in African American men who were at risk for developing diabetes. What the study showed is that physical activity program will increase fitness, which we would all expect, but it also decreased waist circumference, and it improved pancreatic function, meaning that the body was better able to deal with glucose. We also did a church-based weight loss program. And in this program, what we showed was that by doing this church-based weight loss program, we can get people to lose weight, and people who responded more to text messages that they were receiving lost more percent of their body fat. So a community-based weight loss intervention was beneficial for African American adults. My research has also moved into the aging space in recent years. And so the PACE study that I showed you earlier was my study. And that study, again, showed that we can get African American adults to increase their levels of physical activity. We're waiting to see if this study also resulted in changes in thinking and memory and attention. What we also learned is that African Americans are willing to participate in research. And why this is important is because most research shows that African American adults are less willing to participate in research for a variety of factors. But our study showed that African American adults were willing to participate in research, and that they were willing to do the kinds of assessments that we would need to be done in order to assess the effect of physical activity on their health in terms of doing blood draws, in terms of doing an MRI, a PET scan, and some of these other assessments. And that African Americans were willing to engage in a wide variety of interventions, including physical activity, dietary interventions, and medications. We have several studies that are currently going on. So 2 of these studies are called the RATE studies, and these are physical activity interventions that are designed to see if by doing a physical activity intervention, do we improve thinking skills, memory skills, and attention. The COVID pandemic has caused us to pause these interventions starting in February of 2019, but we're going to resume in early 2021. So we want everybody to be aware of this and to partake in the study if you're interested. We also have another study that's going on currently right now that people can become involved in, and that's called DORA. DORA really is looking at the effect of COVID-19 on people's willingness to become involved in research. And this is a survey that people can fill out online. We'll ask them about the different procedures that we might do at the Pennington Center, and also the effect of COVID-19 on an individual's willingness to participate in research. What I'd like to talk about is some of the benefits to doing a research study. One of the main benefits that you get is that you get assessments at no cost to you. And these assessments include things like a blood draw, so you'll get to know about your cholesterol levels, blood pressure assessments, heart rate, you might get a DEXA, which will let you know about your body's composition of adipose tissue to lean muscle to bones and organs. You may also get into the metabolic chamber where you can learn about how much energy your body is burning every day. It might help you be able to manage weight. The other thing is that we compensate people financially for participating in studies. We recognize that it is that you're doing us a favor and that traveling to and from the facility can be difficult at times. And so we want to provide financial compensation as sort of a thank you for people who participate in our studies. A major factor in a major benefit for doing research is that you're contributing to improving your health. So as Pennington does studies looking at trying to reduce weight and improve chronic disease, a lot of our studies have direct benefit to you, or are likely to have direct benefit to you in terms of increasing your knowledge and engaging in behaviors that may reduce your risk of developing a chronic disease or help you to better manage it. But there's also downstream effects. So these things that you learn, you may be able to teach to other people, which may help your friends and your family. But even at a larger scale, a lot of our research, we give back to the community. We tell the community and our community partners about what we found. And then an even larger scale than that is that we often take our research to politicians and try to get them to change policy that will improve the health of the community as a whole. And I think a very good example of this is smoking. So with smoking, people learn that secondhand smoke is very dangerous, and so we now have regulations where people can't smoke outside and have to smoke a certain distance away from buildings. So research is very important, and I encourage you to become involved. If you're interested in any of the studies that I talked about that are ongoing, or if you may be interested in the future, you can call 225-763-3000 to learn about the ongoing studies at Pennington. You can also go to our website at www.pbrc.edu. Learning about the Pennington Center and learning about the kinds of research that we do there. Thank you.